Men over 60, I know you're tired of waking up multiple times every night to use the bathroom. You feel that weak stream, the incomplete emptying, and the constant worry about finding a restroom when you're out. This isn't just inconvenient, it's affecting your confidence, your sleep, and your overall quality of life. The anxiety builds every time you plan to leave the house, wondering if you'll make it in time. What you're experiencing has a name: benign prostatic hyperplasia, or BPH, which affects nearly every man as we age. Your prostate naturally enlarges, putting pressure on your urethra and bladder. But here's what most men don't realize: the weakness in your pelvic floor muscles makes everything worse. When these support muscles weaken, you lose that crucial control and efficient emptying that you once took for granted. The good news is there's a scientifically backed solution that costs nothing and takes just minutes each day. I'm talking about a specific exercise that urologists have been recommending for decades, but somehow it's remained one of the best-kept secrets in men's health. This isn't about expensive treatments or complicated procedures. It's about restoring your natural function through targeted muscle strengthening. My name is Dr. Isabel López, and I specialize in men's health, particularly helping men over 60 reclaim their confidence and comfort. I want to know where you're watching from today. Drop your city in the comments below and follow this channel for more evidence-based health solutions. Now, let me tell you about the #1 exercise that can transform your urinary control and give you back your nights of uninterrupted sleep. The solution I'm about to share with you is called Kegel exercises for men. And before you think this is something only women do, let me set the record straight. These exercises specifically target your pelvic floor muscles. Think of them as a supportive hammock that holds your bladder, urethra, and other pelvic organs in place. When these muscles are strong, they provide better urethral sealing and more complete bladder emptying. When they are weak, you get those frustrating symptoms that are disrupting your life. Your pelvic floor muscles work like a sophisticated valve system, controlling the flow and stopping of urine. They also support your intimate function and can significantly improve your sleep quality by reducing those nighttime bathroom trips. Medical research consistently shows that men who perform these exercises regularly experience marked improvement in urinary control, stream strength, and overall pelvic health. The key is understanding that these muscles, just like any other muscle group, respond to consistent, targeted exercise. What makes Kegel exercises so effective is their ability to restore the natural coordination between your bladder, prostate, and pelvic floor muscles. Think of it as retraining your body's internal support system to work efficiently again. Studies show that men who commit to this simple routine see improvement within just a few weeks. The best part is you can do them anywhere. No one will even know you're exercising. Here's your first power tip for success. Tie your Kegel exercises to 3 fixed moments in your day. Do them right after you brush your teeth in the morning, after lunch, and before bed. This creates an automatic routine that becomes as natural as brushing your teeth. But knowing when to do them is only half the battle. You need to know exactly how to perform them correctly, and that's what I'm going to show you next. The most crucial part of Kegel exercises is identifying the right muscles, and I'm going to give you 2 foolproof methods to find them. First method: next time you're urinating, try to stop the stream midway, just once. Those muscles you just engaged are your pelvic floor muscles. Second method: imagine you trying to hold in gas while sitting in a meeting. You'll feel a gentle lifting sensation in your pelvic area. Those are the exact muscles we want to strengthen. Here's where most men make mistakes. They tense their abdominal muscles, thigh muscles, or buttocks instead of isolating the pelvic floor. Your breathing should remain normal and relaxed throughout the exercise. Start in a lying position where it's easiest to feel the muscles, then progress to sitting, and eventually standing as you get stronger. The key is that gentle, controlled lifting sensation without holding your breath or creating tension elsewhere in your body. Stick with me until the end because I'm going to give you a tracking system that will ensure you see maximum results in the shortest time possible. For the basic technique, contract those pelvic floor muscles for 3 to 5 seconds, then relax for 3 to 5 seconds. Think of it as a gentle elevator going up and then coming back down to the ground floor. Breathe normally throughout. If you're holding your breath, you're working too hard. Your daily routine should be 3 sets of 10 to 15 repetitions, but you don't have to do them all at once. You can spread them throughout the day, which actually works better for most men. Start with shorter holds if 5 seconds feels too long, and gradually build up your endurance. The progression is just like building any other muscle. Consistency matters more than intensity at the beginning, and that brings me to your timeline for seeing real results. Let me tell you about Frank, a 68-year-old patient of mine who was getting up 4 to 5 times every night and had lost confidence in social situations. After just 2 months of consistent Kegel exercises, Frank reported sleeping through the night most nights and having a noticeably stronger stream. He told me he felt confident enough to return to his weekly golf games, something he'd avoided for over a year. Frank's story isn't unique. It's what happens when you commit to this simple but powerful exercise routine. In the first 2 to 4 weeks, you'll likely notice better awareness and control of your pelvic muscles, along with reduced urgency sensations. Many men report fewer nighttime bathroom trips within the first month. By the second month, you should see improvements in stream strength, more complete bladder emptying, and better intimate function. The timeline varies from person to person, but consistency is the key factor that determines how quickly you'll see results. Here's your second power tip. Create a simple tracking diary for 2 to 4 weeks. Rate your urgency, stream strength, number of nighttime trips, and overall confidence on a scale from 0 to 10 each day. This objective tracking helps you see progress that you might otherwise miss and keeps you motivated during the initial weeks when changes are subtle. Review your numbers weekly and adjust your exercise intensity accordingly. Your third power tip is the 60-second timer method combined with the lift and lower visualization. Set a timer for 1 minute and focus on that gentle lifting sensation I described earlier, avoiding the temptation to force or strain. This prevents you from holding your breath and ensures proper muscle activation. But before you start this routine, there are some important safety considerations and warning signs you need to know about. Before we dive in, I want to share something special with you. I have created a 21-day challenge designed to help reduce and prevent prostate enlargement with simple exercises you can do in less than 15 minutes a day. Do not wait. Grab your copy of the ebook right now. The link is pinned at the very top of the comments. Join the Members Club and drop a super like if this information is helping you take control of your health. While Kegel exercises are safe for most men, there are times when you need immediate medical attention. Contact a urologist if you experience persistent pelvic pain, blood in your urine or semen, severe erectile dysfunction, any unusual lumps or nodules, unexplained fatigue, or chronic pelvic pain. These could indicate conditions that require professional medical evaluation and treatment beyond simple exercises. If you have chronic prostatitis or pelvic pain syndrome, be extra careful not to over-tighten these muscles, as this could worsen your symptoms. In these cases, consider working with a pelvic floor physical therapist who can guide you through appropriate modifications. Some men with these conditions actually need to learn to relax their pelvic muscles rather than strengthen them, so professional guidance becomes essential. Your fourth power tip is the safety checklist. Before each exercise session, make sure you're pain-free, breathing freely, and maintaining neutral posture. As you get stronger, progress to holding contractions for 6 to 8 seconds, but only when the current level feels easy. Combine your Kegel routine with proper hydration, daily walking, good sleep hygiene, and stress management for the best overall results. Remember, this is a lifestyle change that supports your long-term health and confidence, not just a quick fix.